So, we're talking about malaria-induced anemia. Yes, we're talking about the whole concept, but we're focusing more on the mechanisms in this lecture. Focusing more on the mechanism because this was an exam question in one of the hematology examinations, where candidates were asked to talk about the mechanisms through what ways can malaria cause what? Anemia, low red blood cell count. So malaria-induced anemia occurs due to multiple mechanisms affecting red blood cell survival and production. So it's affecting the survival of already produced red blood cells, or it is affecting the production. So now hemolysis of infected and uninfected red blood cells. So you can directly destroy the red blood cells, invade them, multiply within them, rupture them, then release merozoites. Bystander hemolysis. So uninfected red blood cells are also destroyed. This is due to immune-mediated processes and the general oxidative stress that this malaria parasite usually puts up in the system. This erythropoiesis, bone marrow suppression. So there's this erythropoiesis. So malaria disrupts erythropoiesis by impairing bone marrow function. Cytokine mediated suppression. So inflammatory cytokines and all of that. Tissue necrosis factor alpha, interleukin 6. So it usually inhibits production of red blood cells. So moving to the next, increased phagocytosis. So reticular endothelial system is activated. The liver and spleen, they are killing red blood cells. They alter the red blood cell membranes. So parasitized red blood cells express abnormal surface pathogens, marking them for destruction. The iron sequestration and utilization defects. So there's iron misdistribution, there's hemozoin accumulation. So parasites usually digest hemoglobin, releasing a chemical known as hemozoin, which interfere with normal iron availability. The immune-mediated mechanisms. So autoimmune stuff, So the malaria can now trigger immune responses, and your immune system can now mistake the normal red blood cells, for something else and destroy them. So these are the various mechanisms in which malaria can actually cause anemia. That's low red blood cell count in the body.